So today we're going to demonstrate the MeniscAssist portal skid for all-inside meniscus repair. With this portal skid, it not only atraumatically introduces our all-inside FiberStitch device, but there's also a special design here at the tip in order to help us reduce and hold the meniscus in order to more anatomically deploy our meniscus repair sutures. So you can see there are two cutouts here, and there's a nice tip that can hold the meniscus either for an unstable tear or sometimes just hold the meniscus a little bit up or a little bit down if you're using a portal for a different reason, for ACL or something, that will help you have a more anatomic repair of the meniscus. So here we have a right knee. Our camera is in the standard lateral portal, and we've got our probe coming from the medial portal. And we've simulated a tear in the posterior horn of the lateral meniscus. This tear would most likely be common with an ACL reconstruction. And today we're going to show just how that MeniscAssist can really help hold and reduce this tear to provide better placement of our all-inside FiberStitch suture. So for this tear, we need to consider the popliteus hiatus. So you could either come from this contralateral working portal, or we can move to an ipsilateral working portal. And you can see that this is going to give us a little bit more of a perpendicular trajectory. I think portal placement is very important when performing all-inside repair. So we're going to bring in our FiberStitch, and this is a 12 degree. And you can see that we can get to the periphery of the tear, but with this, it's really hard to get above the tear in order to perform an anatomic reduction. So this is one traditionally that you might have to consider like a horizontal mattress, but it's really hard to get on the other side of that tear. So what we're going to do is we're going to use our MeniscAssist to help us. So we've just put a little bend in here which facilitates this going in, and also our assistant holding it. But you can see how this works. So basically this nice blunt tip is very versatile, so we can, if it's a very unstable tear, we can reduce this tear and hold it reduced while we get our suture in. If we're trying to get sutures on the inferior aspect, this can assist greatly. And then here, for this type of tear, we really want to get on the top of it. So this MeniscAssist is going to help us hold the meniscal tissue down in order to get an anatomic placement of our FiberStitch. So we simply have our assistant hold on to this part of the skid, and that's where having the bend really helps, and we're just going to keep that in place. So now you can see we're able to get just a couple millimeters on top, which is exactly what we need for this repair. And we're just going to keep this in place. So we'll deploy our first suture, and then now you can see what we're going to do is we're just going to change this skid just a little bit just to help hold that reduction for us. And then our assistant's going to hold that in place, and now we can use it to get a nice firm anatomic reduction for a second suture placement. So once we have our sutures in place, now we can take the skid out, and we'll just kind of put a little bit of tension into the system, and then we'll bring our probe in and tension our first loop. You can see here we've got that suture exactly perpendicular across the tear, and we get a nice anatomic reduction where before it was hard to get that suture on top. We've now created the exact location where we want that suture for our anatomic reduction. So sometimes with an ACL, we're making portals for our ACL reconstruction, so they might be off just a little bit, a millimeter or two. Here you can see where it just helped us get on top of this meniscus, get compression across the tear site for this repair. So we placed our first anatomic reduction suture. In this example, the tear is small, but if the tear extended farther, you may have to place a suture at the inferior aspect of the meniscus. So this is going to come in the same portal, and this time it's just going to help place a little tension on top of the meniscus. So your assistant will hold that for you. And then we're going to come in that same portal, and then we can just slide over. And you can see the difference now with the ability, the meniscus isn't as mobile. So that's going to help us hold it down so we can hit the undersurface of the meniscus. So here we're just going to hold that meniscus as we're going in the undersurface. So we'll deploy our first suture. And these can be very challenging to hit the undersurface of the meniscus, but with that little extra effort to hold it down. And now this one, I'm just going to take the assist out actually. It's going to help us just get underneath that meniscus. And I'll pass that off. And now we can deploy our second suture. So here we'll just add a little tension to the system before we start tensioning it. So here we'll bring that first loop down, and again, brings that meniscus down exactly where it should be, helps with that circumferential compression to reduce our meniscus tear. So here's our final repair construct. So you can see our tear is anatomically reduced. If the tear extended further, we also have our inferior place suture. So again, circumferential compression with the help of our MeniscAssist skid device.